Thank you for your kind introduction, Dr. Landless. So this is actually research that's not just done by me. It's actually done at the Institute for Prevention of Addiction. So there's a group of us who do a lot of this research. I want to give credit to them as well. So today we're going to be talking about exploring the frequencies of wellness and substance use behaviors in Seventh Adventist youth. So it is actually our young people we're talking about here today. And examine selected risk and protective factors as it relates to substance use behavior. Learn the influence of spirituality on those behaviors, and then know how to apply spirituality to prevention. So this is actually research that is done on the campus of Andrews University. So we actually have been blessed really to have a current president and past presidents as well to be supportive of this research, and not only to do this, but also to share it with you all as well. Our current president, Dr. Andrea Lexton, does know I'm here. And as Adventist institutions, we often want to think, oh, our young people, they don't use alcohol. No, they don't smoke marijuana, but in reality they do. And we're actually, as far as I know, the only Adventist educational institution at higher levels that is actually willing to talk about this important issue. So actually this is something that is done every 5 years on campus. It can vary a little bit, but we used to pass it out in class during class time. They don't have to participate, but that is their class time, and so they're there during class, and we arrange ahead of time with the professors. It's not all classes on campus, and it's done just within 1 week, and we kind of choose representative classes with the seminary, graduate, undergraduate, those types of classes. And just the last 3 times we've done this, we added sexual behavior. And what we have noticed with the trends is there hasn't been a whole lot of change. So some people wonder, are they really being honest about these kinds of things on these surveys? Well, I guess if they are lying, they're lying at the same rate every time. So chances are no, they are not lying, because we don't see much of a change. And we used to pass it out in class with a paper survey, but this last time we had a great graduate assistant who suggested, hey, why don't we actually try to do it online? So there's a lot of online survey instruments that you all probably know of. We use SurveyMonkey, and we set it up online, and we had graduate assistants who actually came to those classes, wrote the address on the board, and they went online. And most of them actually used their cell phones. And we actually found cell phones even worked better than laptops because it's more private. You know, you can have it down here as opposed to a laptop screen that would be up here. So I recommend considering that for your future research. And we get about, on average, 70 students who participate in this. And yes, it was approved by our institutional review board. So again, they did not have to participate. It was anonymous. So this actually looked at some trends here. So when we're thinking about alcohol, so alcohol is right up there, that higher one. And you notice from 2005 to 2018, it has gone down. The second one there is tobacco. You see that has gone down over the years. Marijuana, though, this third one, has been going up over the years. So let's actually unpack that a little bit more. So what's really going on is, again, there's not a huge change, but those changes are actually pretty typical for the nation. College students, on average, are consuming less alcohol, less tobacco, but also more marijuana. From a public health perspective, that's a good thing, but unfortunately, marijuana, not so good. It's not as harmful as alcohol, but it's not harmless. And that's the problem with this younger population, because it was initially approved for those who had medical problems. It's thought of as a healthy thing or a good thing. And amongst Adventists, that can kind of be a problem for that kind of thinking. So we wanted to unpack this and try to understand better what's going on. But one thing that is important to note, again, as Adventists, we're noticing that we're wearing more jewelry, and there's kind of a concern like, oh, we're becoming more like the world. But when it comes to substance use, the health message is still really strong. And so that is an important thing that you guys are doing, is actually helping us not be like everybody else. Now, some of what's going on in the United States is there's more acceptance of diversity. Like, you know, you've probably noticed more vegetarian options in our local restaurants. There's maybe more acceptance of people not drinking. That could be part of why we're not necessarily becoming like everybody else. So we also not only took substance use, but we also looked at just wellness behaviors. I mean, how are they doing? Because again, we're not just teaching them not to use substances and alcohol, but we're also teaching them to live a healthy lifestyle. Well, these are college students. So when you're actually looking at the numbers here, the never up here represents 1 and always represents 6. And you see all the different behaviors we asked about. But the average is 3 point something, which is somewhere between sometimes and often. So they're not really being all that healthy. And when you look at the average means, the lowest is actually sleep, which you can kind of understand amongst college students, right? The highest, though, is water, So they're doing a little bit better with water. So again, let's try to understand these trends a little bit better. So class standing age, you can imagine, as they get closer to alcohol being legal in the United States, which is the age of 21, the closer they got to that legal age, the more likely they would have consumed alcohol in the last 30 days, and even went beyond even into graduate school. So when you think about changing the legal age of alcohol down to 18 in the United States, we don't really recommend it based on these statistics. Now, ethnicity, again, these are actually similar to the United States, the rest of the United States, where these certain populations, Caucasian and Latino, do have higher rates of alcohol use, and Asians and African Americans have lower rates of alcohol use. So again, we really feel these statistics are fairly accurate. As we mentioned, we also looked at sexual behavior. So this is a correlation. And so when you see a correlation of 0.36, that's not a huge correlation. A perfect correlation would be 1, but it's still statistically significant where there's less than 1% chance that this is not a relationship. So again, not causational, relationship. So the more alcohol someone used, the more likely they were to have multiple sex partners. The more alcohol or marijuana they used, more likely to have hookups in the last 12 months. Now, hookup is any sexual behavior with someone you hardly know. And same with sexting, more likely to do those things if you're using alcohol and marijuana. And what sexting is taking sexually suggestive pictures, sexually suggestive text, and sending it to each other. So they're more likely to do those things. Now, when thinking about prevention and faith, these are actually measures that are kind of looking at whether or not someone has really internalized their faith, or are they actually following their faith because they want to. And so if they share their faith because God's important to them, they see the negative there, that means they're less likely to use alcohol. Now, not statistically significant for marijuana use, though, but definitely when it comes to alcohol use, sharing your faith because God's important, and sharing your faith because you'd feel bad if you didn't. So again, this is an important thing to you, less likely to use alcohol and also less likely to use marijuana. So church attendance, just going to church, is actually less likely to use alcohol, marijuana, Bible reading, going to Sabbath school. You have to get up early to go to Sabbath school. Going to religious programs. These are ones that aren't necessarily required. These are ones that they're just wanting to attend, less likely to use alcohol. And the statistic that Dr. Landless referred to, again, believing the body is the temple of the Lord. So again, we want to treat our bodies well and take care of our bodies. They are less likely, statistically significant, less likely to use alcohol and marijuana. So again, the health message is really making a difference. And you see, being committed to being a Seventh-day Adventist, that's this up here, again, because of our health message and acceptance of that health message, less likely to use marijuana and alcohol. And then just now, a vast majority of our students are Seventh-day Adventist, which kind of makes it unique compared to maybe other Adventist institutions. A vast majority are like 80-some%, almost 90%. But we do have some other faiths, and so we wanted to see again, all the other previous statistics are just Seventh-day Adventist students, just to make that clear. But when we're comparing our Adventist young people with other religious traditions, yes, there's only 14% of them have used alcohol in the last 30 days compared to other Christians, so that's almost 50%. But other religions now, there's only 7 of these individuals from the Islam faith and Buddhist faith. But they also are a religion that teaches that abstinence of alcohol. So again, similar statistical results. And those who don't have religious preference, 25% of them have used alcohol in the last 30 days. So, okay, these are the stats, right? Now, we want to kind of understand what are these stats about, especially when it comes to wellness behaviors. We didn't really find a whole lot of risk or protective factors as it came to the wellness behaviors. So what I did with a graduate assistant of mine, we actually did some focus groups. So let me tell you a little bit more about our focus groups. So my graduate assistant is actually from Ethiopia, and he's not an Adventist. So you really want to have different opinions when you're actually listening to and trying to come up with themes and identify results from qualitative research. So we did this last fall to follow up with a survey that was conducted last spring. And it was open-ended questions, which is typical for qualitative research. And we're just trying to understand the wellness behaviors, mental health, physical health, substance use, and what roles various things might play to actually affect those behaviors. So there's a total of 5 groups, about 4 to 10 per group, because you want them to be able to have a conversation and not feel left out. And there is about the same amount of ethnicity diversity and gender diversity that we have that is representative of the population that's at Andrews. They were recruited from general education social science classes. That's where they were recruited from. And so they had a variety of majors that they represented. So what my graduate assistant and I did, and he did the typing of actually transcribing, we actually studied it, looked for codes and themes, and this is the themes that I'm going to be sharing with you. And the themes that are on top are the ones that are most commonly identified on these subject matters. So we asked them about substance use. And so they said, you know, it actually happens more than you think as an Adventist institution. Again, it's not just Andrews, trust me, it's not. Those who study abroad said it's a problem there. Those from other colleges, same problem, it's happening, especially in our dorms. And they know it's wrong. Again, the health message is very clear. But then because of that, it happens undercover. And you know what? In the United States, there's just that cultural expectation. You're going to use alcohol. It's just part of that partying, you only live once kind of idea. And the reasons why they're using is it's a way to cope with stress, a way to get away from emotional distress, like that's why they might get drunk. And they said it's just a way to have fun, relieve boredom. But they said it depends on their peer group. So they don't have peer pressure to drink, but if their friends are going out to a party, they're going to go to the party. They're not going to stay home. But they also said some substances do actually help with productivity. So again, when you think about a college student wanting to succeed, thinking about grad school, Adderall, which is a stimulant that is used to treat ADHD, sometimes is used to help with focus and staying up late to study. Caffeine also for the same reasons. So the quote right here to the right actually kind of represents what the students were trying to say about substance use. So I'm going to read it for you. I think one thing is, although we're Adventists, we're also 18 or 20-something, and generally, people associate college with fun, and a lot of the idea of college is drinking, getting drunk. All these recreational activities, and some people want to experiment. Some people, they're not necessarily set in their faith. This isn't a thing they can't do. It's just like the ideal picture of college. So again, they have this assumption, this is just what you do, and if they haven't really accepted the faith, that's not necessarily going to stop them. So we also asked them about physical health. So again, those wellness behaviors, were really concerned that they're not really being all that healthy. So what they talked about when it comes to just, what do you think of physical health? They said, you know what, going to the gym, they really associate the gym with health. So a center like this, and actually Andrews University is building a wellness center called the Andreasen Wellness Center, similar to this one. These are good things. They really associate gyms as a place for health. And they know it's important, but you know what, they're young. And remember when you were young, you felt invincible? Well, they do too. So they're like, I can eat junk food. Oh, I don't really need to exercise regularly. And they said it's really challenging. It's hard to fit in the time to go to the gym. And they said it really, again, depends on your peers. If your friends are going to the gym, you're going to go to gym. You're not necessarily going to want to go by yourself. So here's a quote to represent that. I think the majority of us think it's impossible because we're drowned with work or school stuff. We have to do this and that. We also want to be socially active. So taking care of ourselves properly just gets pushed down to the bottom sometimes. So again, because they are like, I can wait. I have so many other things I have to do that are more important. So when we asked about, well, what are some barriers? What are the things that are really stopping you from being healthy? Well, it's that stress, right? That all the things that they have to do with school, the studying, and the pressure to succeed, it's just hard for them to really be healthy. And because of their managing time with school and homework, but also social lives, including media time, their social media presence, they just have a hard time balancing it all. They also said that the gym, and right now, the gyms are located in the dorms, they're not open at convenient times for them, so that was one thing that they mentioned. And they admit, you know what, really it's up to us. We're just not making good choices. We're staying up late, staying up to 2 a.m., and even bragging about only sleeping 2 hours the night before. And they're eating junk food. There's healthy options, but there's also not healthy options, and they know they're not doing well. And part of what's going on is they're not really happy about being in college, a lot of them. They're feeling kind of, especially more and more in Western societies, and I think around the world, we're needing to go to college to even just have a middle-class, decent lifestyle. And often at 18, they don't know what they want to do. So they're being pressured to go to college. They don't necessarily know what they want to study, and they're being pressured to go to Adventist colleges a lot of times, and they're just not happy about being there. So here's a quote to represent this. I mean, the school really pushes the health message, and so they offer healthier food choices in the cafe. And I feel a lot of people do take advantage of that. Having the gym in the dorms, that gives people access at certain times during the day. It really allows students to go and use them and exercise. I just feel a lot of college students just don't. They just don't. With the time and being overwhelmed, it's just easier to just sit in your dorm and watch television and just let it all go away. So we wanted to find out, what role does religion play in health behaviors? So there's really two main themes that we identified. And again, religion is a helpful thing. The health message is a good thing. It sets that standard that we do not use alcohol, we do not use substances. And it also, because of that message and also just our faith in general and having strength in the Holy Spirit, it helps you resist that temptation. And also it's a way to cope, because remember, sometimes they're using these substances as a way to cope with stress. But you know what? If they haven't internalized that value and they're feeling forced to do this and they don't understand why they need to do this, it's going to make them feel guilty. And then that might make them use to feel less guilty, and then, lowers their inhibition. Or they just rebel. They're like, you know what, you guys, I don't want what you're doing. I don't like it that you're forcing me, so I'm just going to rebel, if they have not internalized that value. So here's a quote. I think the church tends to shame people into doing that a lot of the time. It's not do this because it's good for you. It's more do this because if you don't, you aren't doing good. You're bad because of it. Instead of shaming people into it, just encourage them to live a godly life, a Christian life. So instead of forcing them, we want to actually encourage their spiritual walk. So these are the recommendations that the focus groups actually had. So this is them. This is not just us summarizing. This is what they said, and again, we identified certain themes. So let me try to explain what's going on with the students, the way they described it. They are feeling forced, they're feeling isolated, and they aren't feeling respected. So this is kind of what they're kind of talking about. They feel not cared for because oftentimes, and I don't know how other Adventist institutions are, but the dorms, when you get tons of money donated, it's typically to a new building, right? Not to maintain dorms, but you know what? That's where they live. That's where they spend their time, and that's where they feel cared for. And so what they want, and actually that is Andrews University's next large building project, is my understanding. They are going to be renovating the dorms. What they really need is actually privacy. They need quiet. Think about people who are introverted, people with ADHD or sensory issues. Quietness and privacy is actually the most important thing for them. When it comes to health, they don't want to get their water from the tap water. They say it's not that great. They actually want to have filtered water like we have in the back there, so they want it too. They also don't like it that they have to get all their meals from the dorm. They want to have options. They also want to have easier access to the gym. So actually, I think the Wellness Center is going to be open until 10, so that's a good thing. But again, with our Adventist institutions being in more rural areas, which is a good thing. Now, Loma Linda's not so rural anymore, but it was back when it was instituted. Andrews is still definitely rural. They want to have transportation options. A lot of them come without cars, and Andrews, and I don't know about any other institutions, they don't have public transportation. So maybe they can have a rent-a-car by the hour type of thing, and it's my understanding Andrews is looking into that, to be able to have some freedom to maybe buy healthier food. And you know what? They want to be treated like adults. They don't like the curfew. They don't like the mandatory chapels. They want to have choices and options and be treated like adults. I'm not saying you should get rid of all the rules and let them stay out till all night. But again, they want to be treated like adults in how we approach them. And again, we want to think that they're not doing these things, but they are. They are using alcohol and other substances. And they say, media is kind of normalizing it. Again, it's a normal thing for college students. Media is normalizing marijuana use, making it look like it's kind of healthy. We need to kind of tell them, these are the risks. This is what happens when you drink this much alcohol. And, vodka has a much higher alcohol density than beer, for instance. They don't know these things. And so they actually think that should be part of their orientation when they first come to the university. So in summary, with this research, alcohol is down a bit, so that's a good thing. But marijuana is more than doubled, and it's actually used more than tobacco. So age, again, with increasing age, they're more likely to use alcohol. Ethnicity does affect substance use. These are statistically significant. And yes, if they're using substances, they're also probably engaging in risky sexual behavior. And religiosity is protective, but it's really more protective if they've internalized it and they love God, they want to share their faith, they believe in the health message. These are all good things. But if they're being forced and they don't understand why, they don't understand the health message, it can actually be problematic in how they approach religiosity, and it might cause them to rebel. And you know what? Being in college is hard. We need to be more understanding, be more sympathetic of our students. Now, don't make college easy, right? They don't need that. But just be more supportive and understanding of the struggles that they're having. Maybe help them find that balance that they're really looking for. And there are just some small changes that colleges actually can make. Again, improving the dorms, and it's really that sound is really more of an issue. Make sure there's a wellness center, something like this, where it's good long hours for them to be able to participate in those later evening hours. There's, again, these small things that maybe give them more choice and more freedom to help them feel like they are cared for and respected as our young adult Seventh-day Adventist young people. Thank you very much for your time.